Thought Leadership Summit 2026, an initiative by HOSMAC. With us, we have Dr. Abhishek Pawar, who is the Associate Director at HOSMAC. Hello, sir, and thank you for coming here.
It's a pleasure.
So, sir, you had a panel discussion on outsourcing clinical services. So, how you are seeing the outsourcing clinical services industry in the healthcare infrastructure? What are the benefits of this, and how you are seeing that it will give the advantage in the future?
Right. So probably a decade or two before, in terms of outsourcing, the first thing that hospital owners, promoters would think of is outsourcing non-core activities, which is not related to hospital service providing in terms of facility management, housekeeping, laundry, linen, security. So these are non-core activities, and the clinical services, be it the OPD, IPD, surgeries, pathology, radiology, they used to do it in-house. Over the last 1 or 2 decades, what we've observed is, there are multiple factors, due to some reasons, hospitals prefer outsourcing clinical services as well as clinical support services. So when I'm referring to clinical support services, I'm referring to departments which help the clinical department in optimum function. Be OPD, IPD, surgeries, these are core activities, and the clinical support are pathology, radiology, endoscopy, dialysis, bone marrow transplant, radiation oncology. So over the last maybe 10, 15 years, what we're seeing is a lot of traction in terms of outsourced service providers who are able to bring in a lot of expertise, who are able to bring in a lot of capex into the hospital. So that offloads the hospital from a lot of capex. The hospitals become more asset light, and also the hospital gets access to experienced partner service providers who know the art of managing a certain department much better than a conventional hospital.
Yes. And sir, how HOSMAC is contributing into such kind of outsourcing clinical services, and how HOSMAC is looking as a boom in the future industry?
Okay. So in terms of HOSMAC, we do get a lot of clients who want to set up their hospitals typically in tier 3 cities or tier 2 cities. There are constraints with regards to capex. Land may not be a constraint. They have the will, but probably not the budget to spend on something as high-end as cancer care, which probably a hospital with cancer and without a cancer, the project would probably scale up another 40 or 50 crores, and they don't want to. They're not bullish in the initial years. So the best way for them to go forward is probably build a bunker, build a civil real estate, and get in an operator like a SCG or American Oncology Institute or a CBCC, who are masters, champions in their field. They pump in the equipment, which probably is again very capex intensive, like I said, 35-40 crores, and they have the expertise to manage it well. So this is where consultants like HOSMAC play an important role in terms of advising the client the right model to go forward with. It's a win-win situation for all 3 stakeholders, be it the hospital owner, be it the service provider from the outsourcing department point of view, or be it the patients within the geography who get a superior quality service within their tier 3 city.
And Sir, HOSMAC has conducted very successfully the 7th edition of Thought Leadership Summit. So how you are seeing this summit of yours only?
Okay, so honestly speaking, we used to do Thought Leadership Summit on a year-on-year basis. Post-COVID, we probably took a break. We didn't, do a thought leadership. So it's like a comeback for us after like maybe 4 or 5 years. But I think I'm very happy the way the entire summit was being conducted. The kind of topics that we chose, the speakers, it was very, very enriching, very enlightening, very informative for us as well. And this I'm saying after I come from with 25 years of experience, hardcore operations and consulting background, still it was very enriching for us. I'm sure there's a lot, for the audience also to take home along with them.
Yes, exactly. Thank you so much, sir, for giving us such an insightful conversation on the perspective of how HOSMAC particularly is looking after the outsourcing services, and how the hospital can make it up the clinical services by outsourcing and give the best to the nation's healthcare infrastructure. Thank you so much, sir.
Thank you.